Hey there, welcome back to the channel. In this video, I want to talk to you guys about my experience with uterine fibroid embolism and give a little bit of education around fibroids in general for women, especially us women 40 years and over. And if you're new to this channel, my name is Jessica Vargas. I'm a functional nutrition and lifestyle practitioner, as well as an insulin resistance solution practitioner. And I absolutely love helping women optimize their metabolic health and providing education around their bodies so that they can feel empowered and be able to ask questions, be able to be a big part of their health journey and not have to rely on anybody else to get answers. So, with fibroids, um, fibroids in general are a symptom of estrogen dominance. They're a symptom that there is too much circulating estrogen or too much circulating estrogen in relation to progesterone. And so for me, I will preface that I have a strong genetic predisposition to fibroid growths. Both my grandmother and my mom had hysterectomies in their mid 30s. Um, and so I knew that this was something that I'd have to potentially deal with, just based on history. With that said, just because you're predisposed to something doesn't mean you're going to have it. I want to make that very, very clear. But it does mean you are in the firing squad, right? Not you might not get hit by the firing squad, but you're in it. So you have to take more precautions in many ways than others. For instance, if you have a family history of cardiovascular disease or insulin resistance, aka prediabetes, diabetes, you likely have, unfortunately, the genetics where you can't be as frivolous with your nutrition, with your stress, with certain elements of lifestyle. So I knew I would have potentially to deal with something like this someday. But it really, like most people, until you're dealing with it, you just kind of, it's like in the back of your mind, right? So let's see here. My oldest child is 12, my youngest is 7. And far as I can remember, when I was pregnant with my first, they did see fibroids in the uterus, but they were teeny tiny, less than a centimeter. And of course, it was like, no big deal. Most women have these, they cause no symptoms, and they didn't for me. Women that have a lot of critical issues with fibroids, usually I will say most people are dealing with irregular periods, long periods, short periods, painful periods. They're noticing more things related to hormonal imbalances. Personally, my issues were with fibroids did not affect my period. My periods have always been, well, that's a lie. They haven't always been perfect, but I would say in the last 10 years, they've been incredible. And even through children, they've been incredible. When I was in college, not so great, but I attribute a lot of that to stress and just poor eating. So that was years ago, like I said, 12. And then when I had my second child, of course, they go in the uterus and check things out. They do ultrasounds and they saw the same fibroids. I think it was 3 in total, very teeny tiny, no big deal. And then fast forward to, let's see here, September of, actually, this happened before this, but I didn't really call attention to it to September of 2024. I went to a gynecologist, and I probably should have went to my gynecologist sooner, but my gynecologist, who was supposed to deliver, or technically the midwife delivered my 7-year-old, but she was my gynecologist through my second pregnancy, and I freaking adored her. But it seems like all my gynecologists keep retiring, and I'm like, is it me? But so I just put off going to the gyno for so many years because I'm like, man, I feel good. I'm young, not having any period issues, not noticing any problems with yeast infections or UTIs or anything. So I just never went for years, probably about a good 3 or 4 years. And then I started noticing, I would say in 2021, because this is kind of like, and I don't want this video podcast to be like 8 hours. But in 2021, up until that point, I was feeling really good in my body. I worked a lot on my relationship with food. I never was overweight. I was the bitch that, unfortunately, fortunately for me, unfortunately for everyone else, that got pregnant, gained minimal amount of weight, and then lost it within 2 weeks, was back to my pre-baby weight, if not even lower. Breastfeeding burned the fat off of me. I know that's not the case for every woman out there, but I was always terrified to gain too much weight and never be able to take it off because I had a ton of body dysmorphia growing up. But I was one of the fortunate ones. I did eat healthy throughout pregnancies. I did work out really heavily throughout both pregnancies. I didn't just sit on my ass and I stayed thin. But I didn't have trouble with weight, and I didn't have trouble with weight, especially around my like belly area. I am a lower body heavy set, more heavy set person. I'm teeny though. I'm a 5 foot plus, maybe not quite 5'1", but I'm about 5 foot and a half ish, and I weigh around like 120 pounds. So I am athletically built. I have a butt, but I never had issues with my belly. And I started noticing just more issues. I was tired more. I excuse me, my lower belly pooch was much more prominent in 2021, and I it was having motivation issues to go and exercise. And if you know anything about me, you know I love to move my body. I've been an avid fitness instructor for years. I stopped teaching during COVID, but I did it for 13, 14, 15 years. Loved working out. And so that was like the beginning of my journey with figuring out that I was dealing with some early stages of insulin resistance, and diabetes runs really strong in my family, prediabetes and diabetes. So that was down the rat hole of improving my metabolic health. That's basically when it started. And of course, during COVID, you're drinking more, you're eating more, you're maybe not. I mean, I definitely wasn't going to the gym because it was shut. I was working out at home, but I was challenging myself much more in a gym-like setting. I was teaching spin classes twice a week. I was much more active than when COVID hit. And I think that's true for a lot of people. And so, of course, there were things that were going on in my health where weren't I wasn't helping my health. But it was like, this is weird. I've been super healthy, feeling really good. And then I kind of started taking a nosedive. So, like I said, I went into the rat hole of metabolic health at that point. Fast forward to maybe like 2023, I started feeling heavier in my low abdomen. And I'm like, ah, like eating healthy, moving my body. I got a trainer. I started doing things to push myself more. I was still dealing with some level of adrenal dysregulation, running a business. I work full time in the semiconductor engineering industry. I have two children, family stress, right? So my adrenal health journey has been something that I've been working on also for the last 3 or 4 years, probably about four years now plus. So I was still dealing with some of that fatigue, but I was starting to also notice just heavier feeling in my low belly. And I'm like, you know what? I'm working out. I'm freaking eating healthy. I'm testing my blood sugar. That's getting better. Like, what the hell is going on? I was also waking up every single night to go pee. And I'm like, okay, what I teach my clients is if you're waking up in the middle of the night, especially between that 2 and 4 a.m., you're likely dealing with blood sugar dysregulation. Blood sugar drops, cortisol wakes you up because your body goes into a panic from having low blood sugar and you become awake. So I'm like, okay, maybe it's blood sugar still. So I doubled down on blood sugar supplementation, getting more education around blood sugar, going to my mentors and getting their advice, right? Like I'm like, my blood sugar is great. Like I definitely have pinpointed and figured out where my triggers were. And I'm like, something still doesn't feel right. Like I'm doing all the things. Is it my hormones? So let's see here, 2021, I got them tested. So this is before. And I did have lower progesterone. I did have some other issues going on that I know were attributed to my adrenal dysfunction back when COVID 2021, right? That was what, a year after COVID, like two kids at home on Zoom, working from home, dealing with all the stress, right? Like I think all of us had adrenal dysfunction in that year. Um, but I was like, is this my hormones? Is this perimenopause? Which I do think that, not think, I know that I'm in that perimenopausal time frame of my life, but and I accepted that. And I was like, okay, this is a peri issue. This is something related to what I'm dealing with in perimenopause. And that, again, part of the issue, maybe, but I was like, okay, maybe I need to go and get a colonoscopy. I do have ulcerative colitis, I have an autoimmune condition. So I'm like, maybe there's something there. Maybe there's a mass. Maybe like it accelerated into Crohn's, right? This is just where my mind is always going. It's like something, I'm dying. Did a colonoscopy. It was routine. I have to do it every 3 years because of my diagnosis back in 2011. Clean bill of health. Like my ulcerative colitis was in remission. There was no real issues. So I'm like, is it SIBO? Maybe it's truly a gut health issue, right? So then I went down that rat hole. And then finally I was like, okay, you know what? I'm just gonna go to the gynecologist. I'm gonna ask to get an ultrasound just to see where I'm at with my fibroids because there were times back in 2024 where I would lay on my back, full night's sleep, or mostly full night's sleep. My bladder was full, my bowels were full, and I'd lay there and I'd see this like hump and I'd feel it. And I'm like, that's weird, right? Like there's like a mass there, which of course would freak anybody out. But I'm like, okay, I need to figure this shit out. So I scheduled an appointment with a new gynecologist, very sweet woman. I told her like I have fibroids, look them up, right? Like I would love an ultrasound. And I'm thankful that she's a younger one. She totally listened to me. She didn't dismiss me, which is I know most women deal with. Got an ultrasound and sure as shit, 8 centimeters. The size of a baseball was inside my uterus. And while first, so it's kind of like you get a relief or like, okay, I figured it out. It's a fibroid that is now grown to the size of like 14 weeks gestation if I was pregnant. And then the questions start coming. Okay, now what do I do? Because I mean, my only real symptoms were bulk. They call them bulk symptoms, where you just feel a heaviness. My back would hurt when I would bend over. I had to pee, like I said, every single night, middle of the night. Like I couldn't go 3 hours without having to pee, which is like a pain in the ass. My periods weren't getting affected yet, but here's the kicker. I was dealing with acne. I was dealing with a lot more mood swings, short-temperedness. Um, I won't go into the details of some of the other stuff I was dealing with just because I feel like it'd be a lot for you guys to digest in this video. But I was dealing with a lot of estrogen dominant symptoms, minus the period. With that said, I did start to notice that my period was becoming heavier and heavier. And again, I'm like, oh, perimenopause. Isn't it funny how we just kind of dismiss these changes as normal? Because there's a fine line between normal and common. You know what I mean? I think we all tend to say it's normal when in reality it's just common and we've kind of decided to accept it. So lo and behold, 8 centimeters, this fibroid. Now, just so you guys are aware, fibroids are like a little mini endocrine system in itself. So high levels of estrogen out of balance with progesterone, or just high levels of estrogen, whether that's endogenous, meaning your body's creating it and you're just not excreting it, or exogenous, which means you're drinking out of plastic or you're putting a bunch of shit all over your body, phthalates, perfumes, all kinds of, endocrine disrupting chemicals, whether that's hair products, skin products, whatever. Whatever it is, it could cause high levels of estrogen, especially if you're not detoxifying properly. I don't have a problem going number two every day. So it was just, I was very like, what is going on? Right. So again, perfect storm. I think, like I said, this all started around 2021. My lifestyle was still good compared to most, but not as good as what it was. Pair that with predisposition, genetics, right? And this thing started to grow. And it is common for them to grow in perimenopause and then postmenopause for them to shrink because they need estrogen to survive. So here's the kicker. Estrogen grows them, but they also produce estrogen themselves. So I was in this vicious cycle of my body was producing estrogen, wildly fluctuating because that is what happens during peri. Plus, this little frickin' thing was producing its own level of estrogen. No wonder why I was feeling bloated all the time, despite all of the gut health stuff that I have worked on for years. Irritability, my periods were getting heavier. I the belly fat, like the low belly pooch and the chub, just the thickening. It was like, it wasn't like I was 20 pounds overweight, but it was a good 5 to 7 pounds of thick that came out of nowhere. Again, we normalize this shit. Um, and I was like, hey, yeah. So I was in the position to be like, hey, what do I do? We can just let it ride. My fear was it was going to keep growing. And my mom and my grandmother's fibroids, when they decided to take action, it was around a grapefruit at 10 centimeters. 10 centimeters is when it becomes a big problem. And I've supported women with large fibroids, and it's depending on where it is in the body. For me, the MRI showed that it was more posterior. So it was tilting my uterus back, which made a lot of sense of why my lower back was hurting more often. I had really poor recoveries when I was doing my squats in the gym. And so that low back area was just always tense, tight, and on fire. Makes a whole lot of sense now. So the options are wait and see, a myomectomy. I think I'm saying that right. Basically, they go in laparoscopically and chomp through the fibroid and remove it, or hysterectomy. I've had children. I don't plan on having more children, but you need your lady bits, okay? Unless there's a real good reason to remove an organ out of your body. And by real good, I mean you have done your research and you've had multiple people look into this procedure. Like I wanted my lady bits. And yes, there's HRT. Yes, there's ways to replenish hormones by taking if you take and you do a full hysterectomy. But like physiologically, like you need those bits in there to hold other organs up. So I was like, yeah, I'm not ready to just remove my uterus because many doctors would be like, cool, let's do it. You're not planning on having kids. Let's just get it out of the way. Wasn't into that. And then she mentioned UFE, uterine fibroid embolism. And I'm like, what is this UFE thing? I and then there's of course medication, which blocks estrogen, but that could shove you into early menopause. And she said it was completely very, very uncomfortable, and she wouldn't advise that for somebody in my age, which at the time I was only 39. And so I just sat on it for a while. I was like, I don't know if I'm ready to do anything yet. So that was in September when I figured it out. By the way, this was also affecting like my intimacy life. Like there were TMI maybe, but like after I would be sore for like a week. Like my whole pelvis felt inflamed just internally for a week. I'm like, yeah, this is a problem. So besides that problem, I just was really getting sick of feeling it, seeing it, waking up in the middle of the night going pee. I tried to do hip thrusts and I had problems with putting the barbell over my hips or anything for that matter on my belly. Laying on my belly to do any type of back work. It was uncomfortable. It was literally like I was pregnant with a baseball. And so, geez, let's see here, February, I was like, screw this shit. I'm ready to do this. And so I got the ball rolling. I was supposed to go through Stanford Medical, but they were taking their sweet ass time. So I went through another company called VIP Fibroid Centers, I believe. They have a couple different names. They do a lot of artery type procedures. So uterine fibroid embolism, what it is they go through a radial artery. So whether that's through your groin or for me, you can kind of see it still, like a dot. They went through my artery, literally, radial artery, down towards the uterus. And what they do is they blow this gel-like, I believe, substance into the vein in which the blood supply is supplying to the fibroid. Now, I had to get an MRI before I went and did this procedure to make sure, well, just to see where it is, all of the blood vessels going to it, because if they don't make sure that they're cutting off the blood supply to all of the vessels, it will fail. Luckily, my fibroid only had one feeding vessel to it. So I went in, I got the procedure done. I was very nervous. I was like, actually, the day before, I was thinking about canceling because there are risks to these procedures. And one of the most critical risks could be you get an infection and you have to get a full hysterectomy anyways. But the reason why I chose UFE over like getting the fibroid cut out is because anytime you have open surgery, you're just never the same. You're giving your body a chance to get air into the body, bacteria. I mean, you hear a lot of scary stories about sepsis and MRSA. I'm like, why chance it if they have this procedure? By the way, this procedure is like 20 plus years old, and I had never heard of it before. So I went through the procedure. The first 3 days were brutal. It's like the worst period cramps of your life. I want to even akin it to labor pains. But my doctor said the more painful it is, the more likely it worked. Because what the point of this is to cut off the blood supply so it dies, it degenerates inside of you. So it literally necrotizes in your body, which if anything's dying inside of you, that would probably not feel so great. So it's been, let's see here. I had the procedure March 13th, March 10th. We are in April. I'm filming this April 24th. You guys, like when I lay on my back, I don't feel it. Like, and by the way, um, bulk symptoms is what they call for me. 85% success rate versus like if you are bleeding out and like having to sit in a tub your first 1 to 2 days of your period because it's causing such irregular long periods. Those are like 95% successful. So I knew there'd be again a risk that it would maybe shrink by half, but like I do not feel it. I do not feel it. Um, I would consider this procedure to be a huge success. Now, the other things that I've noticed is that my blood sugar regulation has gotten better. And people are like, huh, here's the thing. High estrogen, which we all know I was having high estrogen issues, mimics low estrogen when it comes to insulin sensitivity. Both high and low cause insulin resistance. Okay. This is why in menopausal women, if you are menopausal, um, likely you have had issues of blood sugar dysregulation, or you're realizing you do, or you're in prediabetes territory or worse diabetic territory. Um, because estrogen in proper balance keeps your insulin also in check. All these things work together and they are all very symbiotic. So my blood sugar has improved, my skin has improved. I'm not waking up in the middle of the night to go pee. I feel like, how do I explain this? I feel like my temperament has improved, like my moods. I'm not as like ready to bite your head off, or short-tempered. I feel calmer, which makes sense. Because when your estrogen is elevated or out of bounds with your progesterone is your calm hormone, okay? Your estrogen is your juicy hormone. When they're out of balance, you could think about it like it dampens the effect of progesterone. Okay. It's like having a pool with not enough chlorine or vice versa, right? You want it to be very, very balanced. So as the estrogen has likely come down in my body and more normalized, progesterone is less dampened and it's affected my sleep in a positive way. The better you're producing progesterone in the right balance, the better your sleep, the better your ability to stay calm, the better your ability to fight off infection. Like it's your anti-inflammatory hormone. I have seen such incredible results from this procedure. And I'm telling you this because one, some women just don't realize they're dealing with fibroids because they just don't go to the gynecologist or they never ask for an ultrasound, or a checkup if they did at one point show fibroids. And two, there's a lot of correlation that um, and relationship between estrogen and insulin. And the women that I work with a lot in my practice are dealing with low energy issues, maybe some headaches, mood swings, skin issues, and weight gain. And there's a lot of information out there. Hormones are a hot topic. But we always start with like insulin first because insulin is something that you have more control over in the moment than estrogen. If you lead an insulin controlled life, you will be able to affect all of your other hormones, thyroid, progesterone, estrogen, testosterone, cortisol. You'll be able to control those and support those hormones better by just focusing on insulin. I will leave it there though. Maybe in the following video, we'll talk more about insulin and how to work with it to better improve your outcomes. But I thought this was going to be a pretty important video just to give my experience about the UFE, give my experience about like the recovery of the UFE, um, and my results, because I do feel like, when you know something is off, you got to trust that instinct. And it took me, unfortunately, I wouldn't say 3 years to figure it out. I would say it took me 6 months to figure it out once I realized that that could have been an area. Because I do believe working on my blood sugar and realizing that I was nearly pre-diabetic, um, was a big foundational step that had to happen anyways. Because just fixing the fibroid and getting it out of the body, if I didn't change anything, it would likely grow back or another one would, right? So the insulin piece is definitely foundational, but it has been a long journey to get to this point. And so in telling you this, I just want you guys to recognize that, getting to where you want to get to in your health is not going to be linear, but there is an answer out there. There is an answer out there. And if you are looking for support in this area, I want you to, drop me a message. Ask for support. The best way to get that in my world right now is by going through the RCRP, root cause review protocol. And this is where I help you identify very quickly your cracks in the foundation of nutrition, of lifestyle, because at the end of the day, like these procedures, like a UFE, can be life altering. But I got here due to cracks in my foundation. And so it's important that we master the foundation before we try to focus on the symptoms. You could do both at the same time, but longevity, vitality, optimization, you really have to have those foundations in place. So if you are looking for more help, I want you to scroll down and check the links below. And if you're listening to this on the podcast, you can check the show notes for the links as well. I hope this was helpful. If you have any questions, drop me a message. Find me on Instagram, Be Body Empowered. Drop your questions below or email me at the show notes. You can find my email address. I hope you guys have an amazing day and we'll talk soon. See ya.